Hello. Uh, Hello, Assalamu alaikum. I am Dr. Saydur Rahman. I'm a pen consultant, Asgar Hospital. Today, I am going to talk about the additional degree that you can achieve for pain to develop your pain career. Uh, so, basically, I will focus on the EDPN exam. But before that, what are the degrees that are worldwide recognized to develop to develop your pain career? I will just give a focus on that. The degree that are recognized and given by various organizations that are FIPP, it is basically intervention fellowship in interventional pain medicine. Uh, that is given by World Institute of Pain. It is organized 4 times a year worldwide, and the next one is CIPS. That is basically ultrasound guided interventional pain exam, and it is also organized by World Institute of Pain. And there are two diploma exam, that is EDPM, European Diploma in Pain Medicine. It is given by two organizations. One is um, European Society of Regional Anesthesia, and another organization is IFIC. They also provide the European Diploma on Pain Medicine. But today I will mainly focus on the EDPM exam that is organized by ISRA and given this degree worldwide. Recently, I have gone through the part 2 exam and I have successfully completed this exam. So I am making this video those who are interested to develop his pain career in EDPM through EDPM exam. So there are a few you will get this information on the websites, but I'll briefly focus on what are the prerequisites. That is, you have to achieve a official uh, anesthesiology training program before applying for the exam. uh, but if you are going to apply for EDPM that is organized by IFIC, you can apply from any discipline. But if you going to apply for the EDPM by ESRA, you must have anesthesiology training before applying the exam. You have to provide 6 months training, especially on pain, for the exam. But if you are going through a larger degree like MD or FCPS, then if you have training program on that curriculum, you can apply for through that. You have to be a SRA member. For getting the membership, you have to apply it through their organizations websites, and you need to apply with that 150 euro, and must have a good command on English, because the second part, that is Viva, that is in a live procedure, and you have to communicate with the examiners in English. One extra annual Congress registration is mandatory to be eligible for Part 2 exam. And who are already practicing as a specialist or a consultant in your institute, you can apply without that 6 months training, but just by getting a recommendation letter from your institution. Now, EDPN exam is two part. Part one is MCQ. After passing part 1, you can apply for part 2 in the next year. In part 1, you will get 60 MCQ paper, and each questions will have 5 stems and true and false. You have to fill up the form with true and false. There will be no negative marking for the candidates, so you can easily answer all the questions, and they mainly focus on all the streams like basics of pain, in anatomy, in radiology, in pain physiology, in interventions, some procedures, some medications, pain essentials medications like all types of analgesics, opioid, non-opioid, NSAIDs, um, nerve stimulating drugs like pregabalin, anticonvulsants, gabapentin, uh, duloxetine, etc. You have to, and ketamine, lidocaine, all drugs that we use in pain practice. You have to have a very uh, good command over all the topics. And number two is part two. Part two examination shall consist a series of viva questions. Actually, one series held in the morning, and two examiners will take your viva. And afternoon session there will be another sessions that is also viva. Will be taken by another two examiners. And first, the you will get a scenario, and they will uh, mm, uh, you will be given that scenario at first, then examiners will take you through different questions from the first scenario, then another five topics they will discuss and ask you questions about that, about your knowledge. At morning session you will get five scenario, and evening sessions you will get five scenario. Two viva examiner will conduct the examination for each candidate, and that there might be observer as well. And basically they in the viva sessions they will focus on five topics. Number one, they will give you a clinical scenario, like you have a trauma, you 5 months back, you have a fall down history, or you have a suddenly you have unbearing low back pain that is radiating to the lower limb, um, and on and then they will give you some clue, and they will ask you about DDs, and through the DDs they will ask you about investigations and treatment, etc. There will be questions of anatomy, like they may ask you about pain pathways, or um, some anatomical pain involvement cells, like pain matrix on the brain, or glial cells, or pain modulating cells. All they can ask you in the exam. There may be another scenario will be drugs and pharmacology, like all types of drugs you have a good command, especially those things are involving pain, from opioid, non-opioid, ketamine, lidocaines, anything they can ask you. Those are, yeah, involved in pain medical management. One syndrome like migraine, postherpetic neuralgia, cancer pain, any syndrome they can ask you. And the fifth questions will be as the interventions they will ask you. Any type of interventions, like um, nerve root block, or any peripheral blocks like vertebroplasty, or the pudendal nerve blocks, or uh, what should I say, that trigeminal neuralgia, gasset ganglion blocks. In our exam there was caudal blocks. So any type of intervention they can ask you. uh, so these are the topics they will focus in your second part exam. uh, the exam fee, the part 1 exam fee is 300 euro, and part 2 exam fee is 700 euro. You have to pay in advance, and they will provide you the date on their websites. And before applying that, you have to get your membership of Extra, and for that you have to apply for the membership by 150 euro. Now I will focus on the reading materials of taking preparation, both for part 1 and part 2. Basically preparations are almost same, but I must say that part 1 is bit difficult than part 2, because in part 2 the examiner might help you, give you some leading questions, open questions, and the topics are almost fixed. That 5 topics on scenario they will focus you on, that I have already mentioned. But in part 2 the books are open. They will focus on every aspects of knowledge on pain, but you have to go through some good books and good guidelines. If you, and at least I think 3 to 4 months of good preparation will give you success in the exam. I will recommend you can go through any types of books, but I will recommend mainly 3 and 4 books that I have gone through for the exam. uh, for part 1 and part 2, the essential of pain medicine you will get in websites, the PDF versions or online versions. And this is very good books. It covers basics, anatomy, physiology, radiology, clinical syndromes, with various scenarios, interventions, ultrasound guided blocks. You will get each of these things in these books, and in details. So 3 to 4 months preparation over that books will give you a very good command on pain. The second part, books I can recommend you, that is the Pain Management by Rajesh Gupta. It's a very tiny books. It covers all the topics, but in a very short manner. It may take at least 20 to 30 days to cover that books. If you can go through all the topics, you will get confidence in a very short time. And part 2 exam, there is a specific topics of interventions. So for the intervention part, you can read these books, Interventional Pain, a step by step guide for the FIPP exam. And by getting the preparation of these books, you will also get a better very good command for the FIPP interventional exam. Very systematically written, and very specific procedures are described here in these books. And the Pain Medicine and Essential Review, it is also a very nice books to good preparations. But the books I have mentioned first, that is Pain Essentials of Pain Medicine, the topics that are not covered you will get in this book, Pain Medicine and Essential Review. It is in short form, but the Essential Pain Medicine is a board. Those who have time, you can, if you go through these books, it will give you a good preparation. And for intervention, you can also for the theory, you can read these books. There's evidence based interventional pain medicine according to clinical diagnosis. It's an excellent book. I must recommend these books those who are taking for exam preparation for the exam. And before beside this, you can also go through some guidelines, especially the European pain guidelines, then New Zealand anesthetics guideline, then NHS guidelines for a specific disease like low back pain, nerve root blocks, caudal blocks, headaches. They will these guidelines they may ask you in the exam as well as in the MCQ part. Now I would focus on the exam fee. Part 1 exam fee I think I have already mentioned is 300 per sittings, and part 2 is 700 per sitting. So that's all in short. If you need any help in future, and if you're taking preparation for the exam, you may ask me in WhatsApp or in Facebook or in my YouTube channel. I will be happy to help you, those who are taking preparation for the exam. So that's all from now. Thank you for watching the video.